The most serious forms of the disease are caused by Plasmodium falciparum and Plasmodium vivax, but other related species such as Plasmodium ovale and Plasmodium malariae can also infect humans. This group of human pathogenic Plasmodium species are usually referred to as malaria parasites.
The malaria parasite typically is transmitted to people by mosquitoes belonging to the genus Anopheles. In rare cases, a person may contract malaria through contaminated blood. Malaria may also be transmitted from a mother to her fetus before or during delivery, which is known as congenital malaria. Because the malaria parasite is found in red blood cells, malaria can also be transmitted through blood transfusion, organ transplant, or the shared use of needles or syringes contaminated with blood.
Approximately 1,500 to 2,000 cases of malaria are reported every year in the United States, almost all in recent travelers. Reported malaria cases reached a 40-year high of 1,925 in 2011. The World Health Organization estimates that in 2015, malaria caused 214 million clinical episodes and 438,000 deaths.
The origin of one of the most deadly malaria parasites has been traced to Africa around 300,000 years ago. The symptoms of malaria were described in ancient Chinese medical writings in 2700 BC. The name originates from the Italian for bad air, malaria. It is also thought that George Washington and Abraham Lincoln were infected with the parasite and that it contributed to the death of Genghis Khan. 3.2 billion, which is roughly half the world's population, lives in areas at risk of malaria transmission throughout 106 countries and territories. An estimated 91% of deaths in 2010 were in the African region due to malaria.
The symptoms of malaria typically develop within 10 days to 4 weeks following the infection. In some people, symptoms may not develop for several months. Some malarial parasites can enter the body but will be dormant for long periods of time. Common symptoms of malaria include shaking chills that can range from moderate to severe, high fever, profuse sweating, headache, nausea, vomiting, diarrhea, anemia, muscle pain, convulsions, coma, and bloody stools.
Rapid and accurate diagnosis of malaria is integral to the appropriate treatment of affected individuals and in preventing the further spread of the infection in the community. In the malaria endemic world, diagnosis of malaria can be difficult for several reasons. One, malaria's clinical symptoms are shared with other diseases and conditions, and many malaria endemic countries lack resources such as microscopes and rapid diagnostic tests to make a definitive diagnosis. Two, health personnel in the areas are often undertrained, under-equipped, and underpaid. Three, health personnel in the malaria endemic world often face excessive patient loads and must divide their attention between malaria and other equally severe infectious diseases such as pneumonia, diarrhea, tuberculosis, and HIV/AIDS. If diagnosed early and if the appropriate antibiotics are available and used, the prognosis of malaria is very good.
Malaria is an entirely preventable and treatable disease. The primary objective of treatment is to ensure a rapid and complete elimination of the Plasmodium parasite from the patient's blood in order to prevent progression of uncomplicated malaria to severe disease or death and to chronic infection that leads to malaria-related anemia. How to treat a patient with malaria depends on a variety of factors that doctors must take into account. Most drugs used in treatment are active against the parasite that forms in the blood. There is no malaria vaccine commercially available to prevent malaria.
Prevention of malaria involves protecting yourself against mosquito bites and taking anti-malarial medication. But public health officials strongly recommend that young children and pregnant women avoid traveling to areas where malaria is common. One common method of prevention is long-lasting insecticide-treated bed nets.